and we're delighted to be here tonight. Now, many of you, I'm sure, have been to Africa, and I started to go as a businessman in the 1980s. And Africa is a place which fills you with sights and sensations. And one of the ones that was indelible for me was the very large numbers of men, women and children that you see in every country, including South Africa, who are deprived of the basics of life that we take for granted. And I vowed one day, when the opportunity came, that I would try and help those people. And that time came nearly 10 years ago, where I found a charity on my doorstep, this one here, that focuses its spotlight on a community of very, very deprived people in eastern Uganda. That's Uganda, and we're on that little area there, close to the Kenyan border. It's an area full of displaced persons from various wars around Uganda. Very mixed, very poor. We exist, our mission is to serve those people by providing what we would call integrated development. So you can see the things we have there. We'll talk a little about some of these. Water, clean water is fundamental. We just take it for granted, don't we? You'll see a picture later of the kind of water that we find people having there. Health treatment, health prevention, primary and nursery education, and providing economic opportunities. We're trying to transform lives and save them as well, and giving people hope. And we've become an established presence now in that area. We don't have any white people there. We have a team of Ugandan people that do our programs. Our first priority for fundraising is to provide the operating expenditure for the programs we've already set up over the last 10 years. And for anything else that we want to develop, for new projects, we have to seek funds specially. And that's why Dr. Bethan and myself are here tonight. The specific problem we want to solve, there are many, but focusing on tonight, is a real problem of maternity deaths. Now in the UK, our average figure is about 9 per 100,000 births. Look at those other figures. Uganda as a country, and these are official figures, which are usually understated. 338, the area we work, 500, one of the worst in the world. And our own figures that we've created show a much higher percentage of death rates of both mothers and children. And why is that so high? Because the area we work in is full of rural tracts. They often get flooded at this time of year. Long distance to very few safe facilities, often which don't work, don't have electricity more than a few hours. And people have no transport anyway to get there.
So over the last 10 years, we've done a lot on the health front. And fundamental to this, we've been providing access to clean water. So we've drilled, nearly 30 boreholes in the area, and we've trained 250 community health promoters. And these are ordinary members of the community that we've trained in accordance with a government programme. And we call them affectionately CHIPs, but they also in Uganda are known as VHTs, which you may be familiar with that term. And the key really is that because they are ordinary members of the community, they are able to change the local people's attitudes towards modern healthcare practices, and that is really key to the success of that programme. We've just completed building the first stage of a health clinic, and this opened in November 2017. And this is a unique public-private partnership between Spotlight and the Department of Health in Uganda. And they provide the clinical staff and the medication for the patients. And this facility has seen over 50,000 patient contacts in its first year. So it's really overwhelmed with very much need. And earlier this year, we built a maternity provision within that clinic, and we are now delivering babies in this unit. So we really need a proper maternity wing, and that is in our plans, but that's for a different time. But critically, mothers and babies are dying because they cannot get to this facility. So we want to purchase a Boda Boda ambulance. And this is a structure that's built around a motorcycle. It's specifically designed to operate in the environment that we work in. And we want to train some of our chips to run this service, hopefully as a 24/7 service to the local community. And it will aim to bring in pregnant ladies as they go into labour to the facility to deliver safely, and if they have a complicated birth, then they will be able to be transferred to a main hospital for a safe delivery. So very much needed, and we will monitor the evaluation and the success of this project easily through medical digital records which we have at the clinic.
Let me finish with a real life story which is very close to us. Festo Hapenden is a member of our school management committee, has been for many years. He's our parent representative. In 1 week, in January this year, he lost 2 pregnant daughters. And he's a man in great grief, called Carol and Nulu. I'd love to tell you the whole story, but Nulu's pregnancy had complications. She was told she needed a scan. He couldn't get her to the scan, and in any case, the hospital was out of electricity and couldn't do it. He desperately tried to get transport. His friends were all had no fuel in their cars. The ambulance of the hospital had no tyres. And in the end, he had to strap his daughter to his old motorbike and drive 5 kilometres. And sadly, by the time she got there, she got into hospital and immediately passed away. He was desperate. He felt personally inadequate. And he said, if only we had transport, I could have saved my daughter's life. Why support us tonight? It's simple. We want to reduce those maternity deaths, and you can help us, please. Thank you.